Welcome to our social services Q&A. I'm Kella Bowers, head of the social services and abuse claims team, and with me today is my colleague and partner Lucy Harris. We requested questions that anybody may have that they wanted us to discuss, but generally the responses were around what sort of claims people might expect coming out of social care at the end of this COVID period, which is not looking like it's going to end anytime soon, but has thrown social services into a very difficult place. Now that is a big question, and social services do cover a large area: children both in and out of care, adult services, learning disabilities, mental health. So there's bound to be things that today in this Q&A that we don't cover. If you have any specific questions that you would want to raise with us, our details are on the website, and please contact us and email us and we'll do our best to answer those questions. If we get quite a few questions, we'll probably do another one of these Q&As to answer them. So, Lucy, if we start with children's social care, now obviously there are essentially two different types of claims that we can receive with regards to children's social claims. Those for children prior to care orders being made, what we'd refer to as pre-care, and those post-care. Now, if we start with pre-care, anecdotally, the conversations that we've had with clients, the biggest problem seems to be lack of eyes on the children and the inability to go out and assess them properly. Has that been your experience in terms of conversations with clients?
Yes, I think, we've been keeping in contact with clients during this period, and you're speaking to them to see how things are going, and I think they have found that very difficult. I think the issue, of course, is that it's all to do with assessment. You're assessing risk all of the time, and risks change. And I think one of the primary considerations that they've had in mind is that having risk assessed a family pre-lockdown, they've obviously taken into account the fact that a child is in school for a good period of the day, that they have access at weekends maybe to youth work or children's centres or extra sources of support. And one of the biggest problems, of course, during lockdown has been that most of those have shut. So whereas you've risk assessed a family as being able to cope, that they're above the threshold whilst that support network is in place, then that might not very well be the case now that all of that support network has been removed. And I think that's been a real challenge. And of course, whether families are prepared to engage. We've got families, no doubt, up and down the country who have been shielding or have not been able to open the doors to allow social workers in. We've got families who are perhaps non-cooperative and haven't been prepared to let families in and social workers in, sorry. So I think all of those things are presenting real issues and trying to get a real true reflection of what's going on in a family situation has no doubt been difficult.
Yeah, and we've got situations with, like you say, families that were probably managing quite well before lockdown because of the access to those additional services, not receiving those additional services. And the mere fact of them all being locked together in a house with situations where domestic violence is a problem with a family, that's going to be exacerbated. Drugs and alcohol, mental health issues are all going to have been exacerbated during this period. And like you say, from my conversations with clients, that's been the most difficult thing, because the duty still remains to safeguard children and do what you can to maintain and ensure the welfare of those children. But when you're trying to undertake assessments by Zoom calls or by telephone calls or by socially distant visits to the house where you stood in the front path trying to talk to the family through the door, you don't get the full picture, and you're not getting that feedback from schools and health visitors. Now, of course, the government made it clear that vulnerable children should have access to schools, but if a child's not on a care order, you really can't force that child or that family to send their child to school. And it's interesting, and we'll talk about post-care in a minute, but it's interesting the information that you located, Lucy, about foster carers saying that a large proportion of foster children even haven't been accessing that vulnerable child school education provision. So it is a situation of not having eyes on those children, but still having that responsibility and duty to make sure that you're doing everything you can to safeguard them. And I'm sure we will say this more than once in this Q&A, but in order to deal with claims that come out of this current situation and claims that children have been left in dangerous situations, you really need to be able to see the voice of the social worker in the documentation. Just to say what you actually ended up doing isn't enough. We have to see all the machinations, all the discussions that happened around what you ended up doing and why you ended up doing that. So all the options you looked into, all the efforts you took to make sure that you got to see the child. If you couldn't, why not? What alternatives were put in place? And why you ended up in the position that you are. Because let's not forget, this is at the moment is all anybody talks about, the COVID situation. But when we're dealing with these claims, we might not get notification of a claim for 12 months. We may not deal with the actual claim or get something to court for years and years and years. So what we think of as obvious now, that we've made a decision obviously because of coronavirus, may not be obvious looking back at this when you're looking at social care documents in 3, 4, 5, 10 years' time. So that has to be the main message that we get over to people. And for insurance officers watching this, in terms of feeding back for risk management to social care departments, that is the message that you should be getting over to them, in my view, that you need to record, and make sure that we can hear the social worker's voice in those documents, which at the time, they've got enough to do at the moment. So it's another burden on them, but it is so, so important.
I think that's absolutely right. I think the other thing just to mention when you're looking, I mean, obviously we work on these claims when they become claims. Of course, in the pre-care period, whether a liability arises is a thornier issue, isn't it? We've obviously had, and you've probably heard this goodness knows how many times, but if you're looking from a negligence point of view as to what the duty of care is to a child prior to them officially being received into care, then you're looking at CN and pool. And I think it's fairly well accepted now that unless you have placed the child on a care order or in Section 20 care of some sort or another, then you don't hold a statutory duty towards that child. So even though that child may very well be at risk, they might be on an at-risk register via the Child Protection Register, or they may be categorised as a child in need. Strictly speaking, in negligence, you may not owe them a duty of care, but of course we're all aware that the Human Rights Act sits in the background and shouts quite loudly sometimes. So I think that's why the recording is so important, because actually if that child is at risk of significant harm, and it is of a severe level, you can't ignore it, whether there's a negligence duty or not. You have to put steps in place. And I think there will be some interesting cases, actually. I know we'd heard on the grapevine that one social worker had been so desperate to try and place a child and there was just nothing available, that they'd even had to take that child home themselves. Now, that's difficult in some situations. If nothing happens, no problem at all. But should something happen when that social worker takes that child home, then you're sort of straying into the territory of assumption of responsibility and those sorts of arguments, which legally speaking become quite thorny. So yeah, you've just got to have that radar on, haven't you?
Absolutely. And with, like you say, with Human Rights Act cases, there'd be arguments of perhaps if a child's been left in a very dangerous physical or sexual abuse situation, arguments of Article 3, inhumane and degrading treatment, as well as Article 8, family life. And they are complicated cases and they are becoming more prevalent.
That's right.
Just in terms of those, what you mentioned there about the social worker taking the child into care, that does bring us on to children that are in actual care situations with a care order. one thing that has come up a couple of times, and I've discussed with clients in quite a lot of detail, is the use of unregulated placements. With children who are complex and have significant difficulties, placing them can be extremely difficult. And there may be a lot of placements that won't take them because of the behavioural issues. Or indeed, during this period, there may have been a situation where residential care homes have had to lock down because they've had children with symptoms. Foster carers haven't wanted to take any more children in, which even restricts the situation even more than it was previously. And Lucy, you and I know over the last couple of years, there's been quite a lot of case law from the family court of judges decrying the availability of things like secure placements, and local authorities desperately looking around for somewhere to place children. And that's inevitably will have got worse during this period. On the issue of children in care, there is, as part of the Coronavirus Act that came out in March, there was the Adoption and Children Coronavirus Amendment Regulations.
Trips off the tongue, Kella.
Does not. All these legislations, they've just got these snappy titles. But there has been a lot of controversy around that regulation, because particularly the Children's Minister hasn't liked it very much at all, because it's softened the requirements that children's services have to assess children in care, and allowed them to place children in foster care and emergency placements for significantly longer periods. That, combined with difficulty of staffing and assessment, we may find claims coming out of that, because obviously once a child is in care, there is clearly a legal duty with regards to what happens to them then. I think that is slightly more easier to manage, because we have control of the child and we will be able to know where they are, know where they're placed, and we'll have very clear documentary evidence as to what's happened to them. But that doesn't change the fact that the situations may be that they can't find good or the best kind of placement for a child, and they may be placed in places that probably aren't the best, or in normal circumstances where they wouldn't have been placed. And that poses a risk for local authorities as well.
I think it does. And I think, I mean, like you said, it time and time again over the last, I'd say, 18 months, 2 years, cases have got to a high judicial level, and local authorities have been desperately trying to have approved a placement that they know is not ideal, but it's the best that they can manage. And I think the burden on the system is only getting greater. I think if anything is going to make a child's behaviour worsen, it's a lockdown. So those children that were already perhaps difficult to place are going to have found this period even more difficult. And I think it's going to put, even foster carers, even if you've got a child in a placement that was surviving quite nicely, again, once you've removed all of those aids, I suppose, that give some respite to a foster carer's duties, even the foster placements that perhaps were holding up well might be coming under strain. In terms of the regulations, of course, the primary legislation didn't change. It was literally this ability to add flexibility into the system, because they envisaged that social workers themselves would be impacted by the virus, of course. So to enable the system to work, there was some flexibility in timescales and assessment processes. And I'm not certain, I mean, that the reporting seems to be that not a lot of local authorities have actually engaged with that process. I think most of them have tried to keep the ship running. But again, it comes down to what was reasonable all of the time as to what the actions have been taken. I think that the terminology, when you start reading it, the word reasonable is sort of littered through social care legislation, isn't it? But it's using reasonable endeavours. Have you done things as soon as reasonably practicable? And the only way you can prove that is, like we've said before, recording what resources were available to you at the time, and how you chose to prioritise those. So yeah, it's an interesting time. It has been the subject of quite a bit of criticism. Of course, most of those regulations are due to expire come the end of September, and I think there's only a handful that they're thinking of potentially extending, and some of them are those that would impact upon the NHS as well. So, for example, medical reports, I think for fostering and adoption, there's going to be a bit more leeway on the timescales for that, because, of course, medical professionals are very busy.
But coming back to that expiry of September, of course, most of the additional funding that local authorities have been given, a lot of them are saying it's going to run out by that stage anyway. And there was a report recently of Kent County Council reporting, I think it was 250% increase in referrals, which brings us full circle back to that issue of having eyes on children. Once the lockdown is relaxed and children are going out, they're being seen by neighbours, they're perhaps accessing part-time schooling, attending medical appointments, those eyes start to be back on those children, and those referrals start to increase again. The resource that local authorities have to put in place increases at the same time as funding is actually being withdrawn, reduced. So it's a difficult time for social care, and social care has been under the cosh for several years anyway in terms of budgetary restrictions. So it is a difficult time for them. Just to bring us to a close, if we just have a quick chat about adult care. Adult care has been largely the one more in the news, I've certainly found over the last couple of months, and largely because of the situation in care homes. But as to what type of claims we might see out of adult care, interestingly, almost at the outset of lockdown, there was an interesting case called BP and Surrey, which was all around contact requirements for an elderly man with Alzheimer's. But it was an interesting case because it did reflect a number of issues that were in the zeitgeist at the moment. They were all over the press. The care home that he was in made a blanket decision that no one was going to be able to access the home and all contact restrictions would be put in place. The family objected to this and they wanted him to be able to have some access, and indeed that lack of contact was causing him to deteriorate in his mental health. They went before the court, and in fact the daughter of the gentleman had said, I want him to come home, but it was felt that that wasn't practical. And I think, to be honest, there have been a lot of families in that situation where their loved one is in a residential care home. Suddenly all contact is stopped for medical reasons, and they're worried about their elderly relative deteriorating, and their immediate reaction is, we want to bring that person home. Well, that's a resource issue in itself, because a care package would have to be put in place for that person to go home. And whether it's in that person's best interest would have to be assessed. And you can't necessarily get a best interest assessor or a mental health assessment done, because that person doing that can't access the home either. So it was an interesting case because it encompassed a large number of issues. But what the court ended up saying was that they should use Skype and standing at the window to make sure he could see them. And then it was adjourned, but when it came back, by that stage, the daughter had made arrangements for the gentleman to go and live with her with a care package and ended up going home. But cases like that, I think we might find Human Rights Act challenges in terms of deprivations of liberty, Article 8, right to family life in terms of contact. We've got situations where care home staff resources are limited because some of the care home staff were ill. You've got situations which was in the press a lot at the start of lockdown about care home staff not having PPE, and therefore are they able to go in and properly care for residents who are then also isolated in their own rooms within a care home. And if for any reason that's delayed obtaining medical assistance, you can see that becoming an issue that a family may raise in terms of a claim. So I can see adult care being quite a complex area, and an area for the development of Human Rights Act cases.
I agree. I think that's absolutely right. We've often said, haven't we, that social workers are between a rock and a hard place, and I think they are. And trying to balance the right to family life with equally the need to safeguard is inevitably difficult. The case that you just mentioned was actually a really interesting case, wasn't it? Because it had a complete turnaround at the end. But yeah, I think it's trying to be as creative as possible with the resources you've got. And I think if a local authority can show that they have been creative, they've used technology where it was available. I even heard of one care home who had a lot of dementia patients doing a drive-by contact system whereby the family could drive up the drive of the care home and see their particular relative who'd been brought outside and sort of manage a socially distanced contact. And it's these sort of creative ideas that seem to have worked. I think if you're dealing with somebody, like you say, with a memory deficit, then that must be a real concern. But we've seen some occasions where, you know, care homes are being very creative and trying to manage these rather peculiar times.
Absolutely. I think we probably should mention, going back to the Coronavirus Act 2020, that did allow for easements to the Care Act to allow local authorities to suspend duties to assess and provide support and provide and review care plans. Mm-hmm. But of course, that's only available to a local authority if they choose to use the easements, and they have to report that to the government if they're going to do that. And you can't use that retrospectively. Mm-hmm. And in order to take advantage of that, it was based on staffing and resources that were available to the local authority, and if they had a significant number of staff absent because they were in a vulnerable class and had to self-isolate, or they were diagnosed with COVID or members of their family were, then they couldn't provide the service that they would normally want to do, so they needed to prioritise those services and therefore take advantage of the easements. But it can't be used retrospectively. So in a year's time, 2 years' time, you can't look back on this period and say, oh, well, the government allowed us to relax these provisions, and therefore we're going to take advantage of the Coronavirus Act, unless you've reported it.
It was quite a formal procedure, wasn't it? It was very much that the director of adult social care would have had to have liaised both internally and also wider with the NHS bodies in the area to form a determination as to whether easements were justified or not. Mm. And we know some local authorities have. But yes, it's you can't suddenly raise, I suppose, easements if that procedure hasn't been followed at the right time.
Absolutely. And you can't also take any blanket decisions about anything. So you can't say no contact at all care homes, no. We're not going to do this for every social care client that we have. Each situation has to be assessed on an individual basis. And that was one of the interesting questions. If you're allowed to relax the need to assess, but the duty to make sure that a person's human rights are not breached remains, how do you know whether someone's human rights are breached if you're not able to assess what their needs actually are? So that's a bit of a catch-22, which will be interesting to see how that plays out, if there are arguments that somebody's human rights have actually been breached.
Yeah.
That brings us to the end of our Q&A. If you take anything away from this, whether you're part of the social services team or an insurance team, it has to be record. Make sure that we know what's been happening and that the decisions that have been made in the background to them. Thank you for joining us. If you have any questions that you'd like to raise, Lucy and I are on the Forbes website. We're easy to find. You can email us directly and we'll do our very best to answer your questions. Thank you.
Thank you.